Put very simply or oversimply, health inequalities are the unfair differences in health between different groups in the population. My name is David Walsh and I'm a senior lecturer in health inequalities in public health here in the School of Health and Wellbeing. There are different types of health inequalities, so the gap between rich and poor effectively. But we also have inequalities by age, by gender, disability, ethnicity, and a lot of these things intersect, so you get people with multiple disadvantage. And we do research in terms of the data around all those kind of groups, so what's happening to these particular groups in terms of trends in health, geographically, what's happening in different places. So basically exploring the data relevant to those groups which are relevant to health inequalities. So as I say, we do research on the different facets of health inequalities, and recently this has focused a lot on the really concerning changes to life expectancy that we've seen not just here in Scotland but also across the UK. So life expectancy has increased obviously for decades upon decades upon decades, but around about the early 2010s it actually stopped improving, and for people living in poorer areas it actually went into reverse. So what that means is that people were dying younger and dying in increasing numbers, and therefore an extraordinary widening of inequalities. The evidence all points to the effects of UK government austerity measures, which have had a devastating impact on the health of the poorest and the most vulnerable in society. The personal motivation is really that in a rich society, what we're seeing shouldn't be happening at all. So I think it's incumbent on researchers who understand the evidence or who are creating the evidence to try and use that evidence to address the issue and bring about some kind of change. We've tried to bring about impact in terms of the public's awareness of what's going on through different media releases, but also with particular engagement with politicians, so going through the Scottish Parliament, presenting the evidence to ministers, to politicians. And we're also writing a book which basically summarises all that evidence, and we're going to take every opportunity we can to try and publicise that in the hope that that message then reaches policymakers. Yes, I would recommend MVLS to potential researchers. So it's a great place to work, and the big strength of it is I think that there are a lot of people with different skill sets, a lot of people with different expertise. So obviously the advantage is that you can work together collaboratively to try and achieve that aim of basically bringing about improvements in society.